Hello guys, welcome back to my channel. It's me, your girl, as you all know, Yetty. So welcome back to another episode of nursing, and if you have missed my previous episode of nursing, you can click the video. I put them all in playlist for you on the suggested card, or you can click the links on the description section as well. I put all the links there for you. Just click on them, go through them as well. So as the video said, confused. Are you still confused? What field of nursing do you want to go into? Are you still thinking, I'm confused, adult nursing, learning disability or intellectual disability nursing, mental health nursing, pediatric nursing? Which one can I go for? It's so confusing. I know it can be. I was once in your shoes, but I later figure out what is best for me. Okay, so hopefully this video is going to enlighten you and be able to help you out on making the right decision for your field of nursing. Okay, so let's dive in. Okay, as I said, mental health nursing, adult nursing. I'm an adult nurse and I'm a general trained. Yeah. Intellectual disability or learning disability. They call it learning disability in UK and intellectual disability in Ireland. Oh, you know what? Pediatric nursing. What that is for different type of nursing. What are they? Adult nursing, as you all know, we are general trained. We are the first contact you make in the hospital. So when you go on in hospital, maybe if you have been in the hospital, those are adult trained nursing, general trained nursing. Okay, so those are the people that work in the clinical setting, which in a clinical setting, if you're the type of person that loves to work in a hospital and you don't mind the pressure, the workload, how busy the atmosphere is, yes, you can go for adult nursing, because adult nursing, it is a busy area. I won't lie to you, it is a busy area, okay, because when you're going to be working in a clinical setting, but it doesn't mean as an adult nursing you are only specifically focused in clinical setting, in the hospital setting. You can work in the community as well. You can work with district nursing. You can work in care homes. You can work in various fields in the community as well as an adult trained nursing. However, majority of nurses work in the clinical setting, so you can find them in an emergency department, in stroke ward, in cardiac ward, in a different area, in the X-ray department as well, different in theater, a lot of field of nursing. That's where you find adult nursing. We are all over the place. We work a lot all over. But however, our roles are clinical. Our roles can be challenging as well, especially if you work in the clinical setting in the hospital. You get hands-on things, you get too busy. It depends on the area, or you're specialized as well. So things can be very, very busy for us as an adult trained nurse. And however, that is our role. So we get to meet different patients on daily basis. We get to deal with their family as well. You get to deal with different multidisciplinary team at the hospital or in your areas, where you get to meet different clinical specialists as well. So basically, that's the role of an adult trained nurse. You can say it's a busy field. So if you don't mind it getting busy, one thing I'm going to tell you, you will learn a lot as an adult trained nurse. You will be skillful. You will get hands-on things, okay? You will, because you will have the skills. You have a lot of clinical skill, a lot of practical skills, that you will have the confidence in your practice as a nurse. Yes, so if you don't mind to get busy, because you can see adult nursing is a busy field, but it's an interesting field because you get hands-on things, you learn a lot, you'll be skillful, you have confidence in your practice as a nurse. So if you don't mind, you can go for this field, because during your training as a nurse, as a student nurse as well, you will go to placement. If you're in an adult field nursing, you go to placement in a lot of hospital settings, so you will see a lot, you deal with a lot of patient care, a lot of paperwork as well. You have to do care plans, you have to monitor your patient, you have to work with a lot of things. So if you don't mind that kind of the field, so definitely you can go for an adult nursing. So the next one I'll be talking about is ID nursing. ID nursing, intellectual disability nursing or learning disability nursing. You can go for it as well. This field of nursing, they are more of specialist-based nursing. They're like a specialized nursing, which they have their own focus, which means they deal with patients with disability, and they help these patients to promote quality of life. They help them to maintain and manage their independence as much as possible, while also promoting inclusion with their family member as well. So in this kind of setting, in learning disability setting, you can also work in a clinical setting as well, but it has to be in a specialized clinical area where maybe patients that are based in that clinical setting, they are learning disability based patient as well. So you can work, but if they're learning disability patient, you can work with them. But learning disability are more of community-based job as well, because you learn to have a lot of people with learning disability in the community, in some residential homes as well. It's residential where it's just based on learning disability, service user or patient. So learning disability or intellectual disability are specialized based field, which it doesn't require a lot of clinical aspect like adult nursing. It doesn't involve you to be more practically based, but it's more of patient-centered care, orientation, like trying to promote their quality of life, trying to engage them. You meet and work with multidisciplinary team as well, but it's not as busy as adult nursing. Definitely not busy as adult nursing. It's very relaxing atmosphere. You get busy with, you do other things, all the roles of nurses as well. You do assessment, you do vital sign, you do various things that have to do with patient care, but not as clinical like an adult nursing working in a clinical setting. It's not that busy. Okay, so, and if during your placement as well, you tend to go to a learning disability or intellectual disability work area, which the area is much relaxed, and most of the service user you find there, or patient you find that is where they live, that is their home. So which that you are starting the journey with them, you're going to finish the journey with them, because it's the same people you're starting with, you're going to finish with by the time you finish your placement in the area. But in terms of maybe adult nursing, if you go on a placement in the clinical area, which is in the hospital, it doesn't mean if you come to the placement today, you might meet a different patient, then tomorrow you turn up, it's going to be another patient, next tomorrow another patient. So it's going to be like a rolling over changes of things for you in adult nursing. But if you're the type that you don't want it too hard, you just want to take it slow, you don't want something that will deter you, that will push you away from doing this nursing career, you just want something relaxing that doesn't get too much or too overload, or too much or too overloading for you. Maybe you have a busy life or busy family life, so you might want to consider learning disability as a field of study. So the next one I'm going to be talking about is mental health nursing. So mental health nursing, they also sort of like similar in terms of learning disability, because they are special based as well. They are specialized. They can also work in certain parts in a clinical setting which are mainly focused on maybe a mental health patient or patient with challenging behavior. So mental health trainers, they can work in various settings as well. They can work in mental homes in the community. They can work in mental health hospitals. They can work in the prison. They can work in different areas, but which are more specialized based on mental health or behavioral challenge. And some of them as well can work in a care home, because there are some care home settings that have a challenging behavior setting, which this area are focused on mental health nursing, so they can work as well then. So mental health as well is much a relaxing atmosphere, but you come across people with challenging behavior, because you have to, like, as a nurse, your role is to help them manage their life. You have to implement the care as in care on how they can manage their mental health. So basically you're working to help the patient, the service user, to manage their mental health as much as possible in terms of administration of medication, following their care plan, or following MDT plans as well, which is multidisciplinary team on how those patients can best have the quality of life. So that is it really. So if you want to be a mental health nurse and you want to go into the field of mental health, yeah, it's a fun field as well. So you tend to do your placement mainly in a mental health settings. Really, you know that you go to clinical settings, so you go to mental health setting. So you can come across a mental health setting that they don't wear uniforms compared to the other nursing that we are in the. If you work in care home or you work in the hospital, you work in the community, you tend to wear uniform. But in mental health and learning disability, they are sort of similar, because learning disability or intellectual disability as well, they don't wear uniform. Because right now working in learning disability, I don't wear uniform. We don't use uniform. As long as we wear uniform, you would have seen me maybe talking in front of you with my uniform on and stuff like that. We don't wear uniform. So the same thing also applies to most mental health setting as well. They don't have a uniform. So it depends on what setting you're wearing. It depends on how things change as well. Okay. So the last one is the pediatric nursing. So pediatric nursing, as you can see in the name pediatric nursing, they deal with children. That is what we call children nursing. Okay, they deal with children all the way from babies to the age of 17 years. So in terms of pediatric nursing, there's some hospital that have a children department, so you can find them definitely a pediatric nursing in that field. They deal with people that require maybe ventilated care as well, so you can find them in some specialized area as well. So but they deal with children, so they can work in the community as well, children-based community care as well. They work in clinical settings, so they work in children hospital. So if you are a type that loves to deal with children, that loves to work with children, so you might consider pediatric nursing, which is children nursing, as your field of choice. So if you can cope, help with the little one, you can know how to manage them, you know how to work with them, how to care for them, because you can know dealing with children can be a little challenging because their level of understanding as well. If you're the kind of person that you prefer to work in the field of nursing, and if you're the type that love to work with the children, so you might want to consider pediatric nursing as well. So it's a beautiful field as well, but you work mainly with children. So you can't see a pediatric nurse, which is a children nursing, to come to work in an adult settings. No, you are children-based nursing. So it's just your focus is how to maintain the quality of life for the student, how to promote their care, how to promote their independence, while including their family in their care as well. Because most of them, the consent has to come from their family before you can get things done. Compared to adult, whereby you can easily ask their adult to talk to them, they can consent themselves, you can, they can sign things themselves, So, but in children, things are quite different. So if you're the type that loves children and you want to work in the area of children, so you can go for that. So it's in a fun field as well. So it's something you can go for. So if you're still confused, okay, I didn't know what to go. Adult nursing, mental health nursing, children nursing, or pediatric, or learning disability, or intellectual disability. I know 4 fields of nursing itself. So hopefully this will help you to make the best choice for yourself as well. Okay. So I hope you find this useful and educative as well. And if you have any further question to ask me relating to nursing, you can leave it in the comment section, or you can also check my social media and get connected with me on my social media. Send me a private DM and I will be much more happy to definitely respond to any of your questions. And I hope that you find my explanation of breaking this nursing aspect interesting and something you find useful that you can pick on as well, because I try to explain it as much as possible in a simple term to the best of your knowledge. Okay, so thank you so much for watching. Hope you find this interesting, and thank you so much for watching. And don't forget to give me your girl thumbs up. If you haven't subscribed to my channel, don't forget to click that subscribe button and the notification bell so you can get notified for any of my video content on a weekly basis, Monday and Saturday. See you in my next video. Bye.